If your legs often feel cold, numb, or weak, what I'm about to share may explain why and what truly matters later in this video.
Many people notice these changes during simple moments like getting out of bed, long before they ever talk to a doctor.
These sensations are rarely random. They usually involve circulation, nerve signaling, and how the body changes with age.
Stay with me, because near the end, I'll explain the mistake that prevents real improvement for so many people. Before we talk about solutions, we need to understand what's really happening inside your legs and feet as you get older. Often, the first sign isn't pain, but a quiet change in how clearly your feet sense the ground beneath you. Most people assume this is just age, but there are three specific factors working together that explain these changes.
In the next section, I'll explain exactly what caused these changes and why ignoring them is the real risk.
The first major reason feet lose warmth and sensation is reduced blood flow, especially in the lower legs.
As circulation slows, less oxygen and warmth reach the feet, which can change how they feel day to day.
When blood flow is reduced, the feet are often the first place where changes in temperature and sensation appear.
This is why circulation isn't just about the heart. It directly influences balance and confidence in daily life.
This reduction in blood flow doesn't happen overnight. It builds slowly, often without obvious warning signs.
When circulation slows, the feet may feel cooler because less warm blood reaches the surface.
Your feet are farthest from the heart, so even small circulation changes show up there first.
Because these changes are subtle, many people overlook them until sensation and stability are affected.
Beyond major arteries, tiny vessels in the feet also play a crucial role in delivering warmth and nutrients.
When these smaller vessels don't deliver blood efficiently, sensation can fade even if larger circulation seems fine.
Without steady oxygen and nutrients, the feet may feel less responsive, even during simple movements.
This is why supporting circulation is a foundation for comfort and confidence as we age.
As we age, blood vessels naturally become less flexible, which can reduce how efficiently blood reaches the lower legs.
When blood flow slows, the change is often felt as coolness or reduced clarity in the feet, rather than pain.
Because circulation affects warmth and sensation, it also plays a direct role in balance and confidence. Circulation is essential, but it's only one part of the story. Next, we need to talk about nerve signaling. The second major factor behind numb or unresponsive feet is how well your nerves send signals to the brain.
Nerves act like communication lines, carrying information from your feet up to your brain. When these signals weaken or slow down, sensation becomes less clear, even if circulation seems adequate.
One bird versus a champ.
This is why changes in nerve signaling can quietly affect how confident your steps feel.
The third factor many people overlook is nutrient support, especially nutrients that help nerves and circulation function properly.
Without the right nutrients, nerves may struggle to maintain clear signals, even when circulation appears acceptable.
Over time, insufficient nutritional support can quietly weaken nerve performance and affect how your feet respond.
When circulation, nerve signaling, and nutrition come together, the body has a stronger foundation to work with.
The first vitamin that deserves attention is B12, specifically the form called methylcobalamin. Methylcobalamin helps support the protective coating around nerves, which allows signals to travel more clearly.
This form of B12 is already active, meaning the body can use it without extra processing.
Over time, proper B12 support can help maintain clearer sensation and steadier daily movement.
The form of B12 matters because some types are simply easier for the body to recognize and use efficiently.
Some forms require extra conversion steps, while methylcobalamin is already active and ready to support nerve function.
When nerves receive steady support, communication with the brain becomes clearer and more consistent.
This kind of support works best when it's consistent and given enough time to do its job.
The second key nutrient is vitamin B6, specifically the active form called pyridoxal 5-phosphate, or P5P.
P5P helps the body produce neurotransmitters, the messengers that allow nerves to communicate clearly.
Without proper B6 support, nerve messages can become less precise, even when the nerves themselves are intact.
Clear communication between nerves plays a quiet but important role in balance and daily confidence.
When methylcobalamin and P5P are used together, they support both nerve structure and nerve communication.
One supports the nerve's protective layer, while the other helps messages travel clearly along that pathway.
Together, these nutrients don't rush the process. They support it steadily and consistently.
This kind of foundation prepares the body for gradual improvement when used correctly.
When it comes to dosage, clarity matters, because the amount you choose determines whether support is meaningful or minimal.
For methylcobalamin, many studies reference a daily range of about 1 to 2,000 micrograms. For P5P, a commonly discussed range is about 50 to 100 milligrams per day. What matters most is taking the right amount consistently as part of a steady daily routine.
Timing matters, because taking these nutrients with a meal can support better absorption and comfort.
Taking them with breakfast is often easiest because it pairs well with an existing daily habit.
More is not better. Staying within recommended ranges supports safety and long-term consistency.
Simple, consistent habits are what allow these nutrients to support the body over time. Real improvement follows a timeline, and understanding that timeline helps you stay patient and consistent. During the first couple of weeks, most people notice only small changes, and that's completely normal.
By weeks 3 to 4, some people begin noticing clearer sensation or less distraction from discomfort.
These early signals are quiet, but they show the body is beginning to respond.
Around weeks 3 to 4, the body is adjusting, and awareness often increases before major changes are felt.
This is when people often notice small differences, like clearer texture underfoot or fewer distractions at rest. By weeks 5 to 6, momentum builds as the body continues adapting to consistent support.
Staying consistent during this phase is what allows progress to continue without setbacks.
Around weeks 6 to 8, many people begin noticing clearer, more consistent changes in daily sensation. This is when people often describe feeling the floor more clearly and moving with greater confidence.
These changes reflect the body adapting, not a sudden shift, but steady improvement built over time.
When support is consistent, confidence often grows naturally alongside these improvements.
Between weeks 8 and 12, the focus shifts from noticing changes to stabilizing and maintaining them.
At this stage, improvements often feel normal because the body has adapted to consistent support.
This is why long-term support matters more than short bursts of effort or quick changes.
Once progress is built, maintaining simple, consistent habits helps protect what you've gained.
The most common reason this approach fails is simple. People stop before the body has time to respond.
Many people try for a few weeks, don't notice dramatic changes, and assume nothing is happening.
Irregular use sends mixed signals to the body, interrupting the gradual process of adaptation.
Consistency over time is what allows supportive steps to actually make a difference.
Another common issue is using forms that the body struggles to recognize, which limits their supportive potential.
Expecting instant results often leads to disappointment, even when gradual progress is already underway.
Without tracking small changes, it's easy to miss the progress that builds quietly over time. By avoiding these mistakes, you create the right conditions for steady, meaningful improvement. The first step is simple. Choose a consistent time of day that fits naturally into your routine.
Pairing your routine with breakfast makes consistency easier and removes the need to remember later. Writing down even small changes helps you recognize progress and stay motivated.
Simple, repeatable steps are what create momentum and lasting change.
Placing simple visual reminders near daily habits helps you stay consistent without relying on memory alone. Pay attention to small changes without rushing the process, because awareness builds confidence. Even with improvement, never change or stop medications without speaking with your healthcare provider. When these steps become routine, consistency protects the progress you've worked to build.
When you understand what's happening in your body, you can make choices that support improvement rather than guessing.
Getting older doesn't automatically mean losing comfort or confidence. It means your body may need different support.
Real progress takes time, and patience allows the body to adapt at its own natural pace.
You don't have to navigate these changes alone. Guidance and understanding make the path clearer.
When you step back and look at the whole picture, the process becomes clearer and far less overwhelming.
Meaningful change often comes from small steps taken consistently, not from pushing too hard.
The body has an incredible ability to respond when it's given the right support and enough time. Staying informed and supported is how we continue moving forward together. If these insights have been helpful, I invite you to continue learning with us here on Health Hack Hive.
Subscribing, liking, or sharing helps this information reach others who may need it as well.
This video is for educational purposes only and does not replace advice from your personal healthcare provider. If you'd like, share your experience in the comments. Your story may help someone else feel less alone. On this channel, we focus on clear, practical health guidance designed especially for adults over 60. Everyone's situation is different, so always personalize what you learn here with guidance from your healthcare professional. If you find value here, I hope you'll stay with us and continue learning at your own pace. Thank you for watching. Subscribe to Health Hack Hive, and I'll see you in the next video.